Hi, everyone. My name is Blake Cadwell. I'm the co-founder at Soundly.com, and I'm also a hearing aid wearer. And in this video, we're going to talk about an important decision that any hearing aid wearer will need to make. Do you select a hearing aid that sits inside the ear or one that sits behind the ear? And to talk about this, I'm joined by Dr. Amy Starro. We're going to get into the whole topic and talk about pros and cons. But first, I'll show you what each of these styles looks like in my ear. And I'm wearing one of each today. So on this side, you'll see I have an in-the-ear hearing aid. I'll take this out and show it to you. This device was custom molded to my ear. So you can see it has all the contours of my ear canal, has a push button, and just sits inside of my ear canal. And then on this side, much less visible from the front, I have a behind the ear style. And again, I'll show this to you. This has a sort of dome on it and sits behind my ear with the receiver sitting inside my ear like that. So those are the two options that we're really debating, and both can come in a few different shapes and sizes, especially in the ear size. There are options to go much smaller, but that's essentially the decision that we're talking about today. So Dr. Amy, we'll pass it over to you. Can you talk to us about the pros and cons of sort of the behind the ear style, which is the most common hearing aid style?
The behind the ear style, or the RIC hearing aid, that is definitely one of the most popular options. So probably 80% or more hearing aid wearers go with that option. One reason being that you have Bluetooth connectivity, you have the latest technology. It's comfortable to wear. You have that piece behind the ear and that other piece that goes in your ear canal, which can be adjusted to fit comfortably in your ear canal. And then if you have low frequency, good low frequency hearing, it'll give you a more natural sound quality. Now, on the other side of it, some cons to consider. So if you're someone with petite ears, it may be a lot for you to have that piece behind your ear and then the piece that goes in. And then perhaps if you wear glasses or oxygen mask, a face mask, that can be just a lot for that small amount of real estate behind the ear. And for someone with dexterity concerns, that can be harder to manage, that piece that goes behind and then the piece that you maneuver in the ear canal. Sometimes it's easier to maneuver, one piece, like an in-the-ear hearing aid, where you just place that in your ear.
Well, let's switch gears and talk about in-the-ear styles. Now, there are various sizes that you can get, from a kind of fully large size like this, which is an ITE, or all the way down to hearing aids that are invisible, depending on someone's ear canal. Can you talk to us about the pros and cons of this style?
Depending on the size, someone who is more cosmetically focused can have a small hearing aid, like an IIC or a CIC hearing aid. And again, for someone with petite ears, that may be easier to manage if you have glasses or a mask. Certainly during COVID, when more people were wearing masks, they made a bit of a comeback. It also fits to the natural shape of your ear. So it's custom made to fit specifically your ear. And then retention can be another reason. Some people are worried that the piece behind their ear may come off if they're moving around. And then when you have the piece that goes in your ear, that may be less of a concern there. Now, some cons to think about. So if you're someone who wants Bluetooth and connectivity, rechargeability, you may not have all of those features available if you're going for that IIC, that really invisible style, or CIC hearing aid. If you have natural low frequency hearing, you may get a plugged up sensation or that occlusion effect, where you're not getting the natural sound quality coming through because there's that piece there. So those are other things to consider as well.
One important note for anyone who's looking for a hearing aid that is discreet or invisible is that many people assume an in-the-ear style hearing aid is going to be less visible than a hearing aid that sits behind the ear. And I'll say from personal experience, I find many times the opposite is true. My behind-the-ear hearing aid has such a discreet wire that comes up over the top of my ear that people rarely notice unless they're looking directly behind my ear where that device sits. Now, an in-the-ear style, even some of the smallest styles, that hearing aid is still visible and comes out of my ear canal. So as you're thinking about the most discreet option, don't throw out the option of having a behind-the-ear hearing aid because many of these devices have now become really small and really discreet. Dr. Amy, thank you for your time in explaining this important decision between in-the-ear and behind-the-ear styles of hearing aids. And to you, the viewer, we wish you the best.